So with Freedom Day finally upon us, is it really safe to be opening up?
More than 50,000 daily coronavirus cases were recorded on both Friday and Saturday. That's the same levels we saw in January. Deaths are mercifully significantly lower. Shadow Health Secretary Jonathan Ashworth joins us now. Very good morning to you, Mr. Ashworth. You've probably seen the pictures. Nightclubs opened up as soon as they could. A lot of young people who haven't even seen the inside of a nightclub for the best part of 2 years. Very, very happy. Hospitality thrilled. Businesses feel like they can get back on their feet, pay their rent again. What do you feel?
I think today's reckless, I'm afraid, and I can't support what the government are doing. It is like putting your foot down on the accelerator and throwing off the seatbelts. We know the infections are rising, hospital admissions are going up. We know that infections could hit 100,000 a day. That means lots of people very ill, lots of people developing serious long-term illness. It also means, because you've got a partially vaccinated population, that you run the risk of a new mutation, a new variant emerging. So we would maintain precautions like keeping mask wearing, working from home, paying people proper sick pay. I mean, it's going to be chaos today on the transport networks, possibly the busiest day on buses and trains for 16 months. Passengers not knowing whether others are going to be wearing a mask or not to protect, which obviously, you wear a mask to protect other people, not to protect yourself. So really worried about what's happening today. And I think if you'd maintain some of these precautions in place, you could contain the growth of the virus. My worry is we're going to go backwards, that this won't be irreversible, because that's what happened in other countries like the Netherlands and Israel.
Jonathan Ashworth, we've had a message from John on Twitter saying Freedom Day has come. Leicester was in one of the longest lockdowns. All the road cones have been removed, which has made pavements wider. Watch how the virus spreads now with no social distancing. Exactly where you are, you know firsthand how difficult it's been for your constituents and all the people of Leicester, and there's plenty of other towns and cities across the country in a similar situation. What's the atmosphere like there on the street from your constituents that you've spoken to? Are they welcoming in this? Are they saying, do you know what, it's got to come at some point, we've got to make this step? We saw those scenes in the nightclubs at midnight. We've seen how much businesses have struggled, and until we make this first step, we're never going to get past the fear that everybody has that COVID's going to rule us forever.
Well, we've still got some of the cones in Leicester. If John wants to come over to Clarendon Park, he'll see the cones along the Queen's Road. People are worried. People are worried. I mean, if you've got a long-term health condition, or you're very seriously unwell, or you're immunocompromised, mask wearing is really important to you. And what are you going to do? Are you going to get on a busy bus or a busy train? Are you going to go to the supermarket when you know that other people won't be wearing masks? That's not Freedom Day for those people. And I think there's a lot of nervousness out there. Other countries that have done this, I mean, like the Netherlands is a good example. They threw off all their restrictions on the 26th of June, and then the infection rates went up almost on a vertical axis. And then they had to go backwards and had to start closing things down. Israel, we've been talking about Israel these last few months as the most successful country in the world for vaccination. They got the Delta variant arrived in Israel. They've had to bring back masks, and they're talking about a lockdown again because this Delta variant, which of course we got here because we didn't protect our borders. Boris Johnson didn't protect our borders. It's why some people call it the Johnson variant. That got here, and it's really transmissible, and it's climbing again. So look, I know I'll always take my responsibilities to the economy seriously. We do have to support our economy, but I do think today is reckless, and they should have put these precautions in place.
What do you think about this sort of, it's almost an unstated policy of herd immunity? We have around 2/3 of adults vaccinated. There is obviously going to be a rise in infections now, currently running around 50,000. They could get up to 200,000 infections a day. But as long as the deaths are kept very low, as long as hospitalisations are kept low, is there any justification for the argument that's coming from the government that we have to live with it? Schools being off means that there's some kind of fire break there. More and more people will be vaccinated. And then come the autumn, when you see an increase in flu and other infectious diseases, the NHS will be able to cope better because more people will be immune.
Well, dangerous, and you can't game this virus. If they're trying to game it in order to have a better winter, I think that's really, that we know this virus gets ahead of you unless you get ahead of it. Post the virus means that some people will develop serious long-term chronic conditions, not just fatigue and ongoing problems of breathing and headaches, serious though all of that is. Some people develop very, very serious, problems with their kidneys, with their lungs. Other people develop neurological problems. Some people develop, we've had examples of hair loss in women. We've had examples of people losing their teeth. Some people develop serious psychological problems. This is a very, very dangerous virus. But secondly, the way the evolution of the virus works is when you've got a partially vaccinated population and an increasing pool of infection, that puts pressure, the scientists call it selection pressure, on the virus to mutate. And if the virus mutates again in such a way that it can avoid the vaccines that we've got, our ministers have essentially snatched defeat from the jaws of victory here. For what? For the sake of throwing up, so we don't have to wear masks and saying people can't work from home anymore. It's just why I think they should put in place these precautions. And on the winter, we're going to have a really serious winter, probably one of the most difficult winters in the NHS in living memory. We're going to have flu, we're going to have other respiratory conditions. One of the things I'm suggesting to the government is invest in your testing capacity now. So not just testing for COVID, come the winter, we're able to test for other pathogens, other viruses, things like flu as well in society.
I wonder what you made, Jonathan Ashworth, of the sort of the screeching U-turn, not for the first time by the government yesterday. Boris Johnson and Rishi Sunak had obviously been pinged by the app because Sajid Javid has tested positive for COVID, and then all of a sudden they were on this exemption scheme where they were going to be tested. A couple of hours later, suddenly they realised it was a good idea to do what everybody else was doing and actually having to self-isolate. That's one thing in itself. I was intrigued that Tony Blair, former leader of the Labour Party, of course, and one of the last Labour Prime Ministers, turned around and said he doesn't think the Prime Minister should have to self-isolate. He wants him at his desk doing his job. And yes, of course, that does mean that there are some rules for some and some for the other. But the Prime Minister is a hugely important role, and having him at his job where he can do his job and taking part in a pilot scheme. He's double-jabbed, he's had COVID too, is better than having him isolating at Chequers in the middle of the countryside.
Well, I mean, it's just been chaos, hasn't it? I mean, it's absolute chaos. And there's lots of questions as to how Boris Johnson and Rishi Sunak were able to sidestep the rules that the rest of us have to follow.
But Ben's point is, Tony Blair says, let's keep people at their desks, and not just the Prime Minister and the Chancellor, but all, the 500,000 people who got contacted by Test and Trace, who are having to go into isolation because of contact. What about bringing forward that exemption for the double-jabbed to today? Would Labour support that?
Well, just on the Boris Johnson point, he can join Zoom calls from his desk at Chequers or Downing Street or wherever he is. He can pick up the telephone, he can WhatsApp people. I mean, we're told from all that Dominic Cummings stuff that he likes to WhatsApp quite a lot. There's no reason why he couldn't carry on doing his duties, like working from home, like lots of us have had to do.
It sort of encapsulates, doesn't it, the frustration? Because you're right, the Prime Minister could do that, and it was ridiculous that he thought he could, be part of this pilot and get an opt-out. That felt outrageous. But what it speaks to is this experience, particularly, about workers who need to be on the shop floor. Should we bring forward the exemption from isolation for those who've simply been in contact, many of them don't know how, but they have been double-jabbed?
But remember, that isolation, that pinging of people or Test and Trace ringing you up, asking you to isolate, is a symptom of the rising infections in society. And if you allow infections to just climb and climb and climb, you're going to have more contacts. Now, the issue is, if you are double jabbed, you can still transmit the virus. We've got to look at the evidence to see by how much you can transmit the virus.
So Labour don't support what's going to change on August the 16th?
No, but the SAGE are looking at this. So they're going to look at this and they're going to report back in time for August the 16th. What I'm not suggesting is bringing that forward until we've got that medical evidence. I think there is one area where it's worth making an exemption, which is the NHS. because of the intense pressures the NHS is under this summer. We're in a summer crisis in the NHS. And of course, NHS staff wear PPE. I think they should wear higher grade masks in the NHS. We've been calling for that. But I can understand why you would make a special carve out for NHS staff, given the particular issues in the NHS at the moment.
OK. All right, Jonathan Ashworth, thanks very much indeed for joining us this morning.
Thank you.